Agarwal, Social Services Coordinator with Recreational and Community Services, City of Milpitas. And nice to see everyone.
Hello, everybody. My name is John Macon. I'm the Recreation Services Supervisor based out of the Senior Center.
I can go ahead. Anthony Teixeira, City Milpitas, Youth and Teen Program Coordinator.
Robert Mize with Cathedral of Faith.
I'm the representative of the senior community.
Senior community.
Hi, Tyler Jameson. I work for the police department. I'm a patrol lieutenant.
I'm Jay Donahue. I'm a coordinator with the county suicide prevention program.
I'm Vic Ojakian. I work with Jay. Basically, I co-chair the county suicide prevention committee.
Hi, all. I'm Elena Kakachi. I'm the clinical director at CASI, Counseling and Support Services for Youth.
Oh, nice to meet you, Elena.
Nice to meet you.
Yeah, we've met Lisa and Alice.
Yes.
Yes.
Hi, everyone. I'm Sandra Quintana. I've been part of this committee before, this task force before, but am rejoining. And I'm a program manager of mental health in Milpitas Unified School District.
Welcome back, Sandra.
Thank you.
Hi, everyone. My name is Sarah, and I am one of the program managers for Mid-Penn Housing. I'm part of the Resident Services Division for Santa Clara County. And Tom, it's nice to put a face to the voice. We've connected one time before. This is my first meeting.
Welcome.
Welcome.
Hi, I'm Sequeen. I'm a student from Irvington High School, and this is my first meeting. I'm excited to see what I can learn and possibly share today.
Thank you for being here, Sequeen.
Of course, thank you for having me.
We have Pastor Mize. Okay, Salia. Okay, should we, someone is joining. Alicia. Hi, Alicia. Your mic is muted.
Hi, I'm on. Thank you.
So we just introduced ourselves. If you want to introduce yourself.
Okay, yes, I'm Alicia Oko. I'm the Mind Body Wellness Director with Kaiser Santa Clara.
Thank you. So I think should we get started or should we give few minutes to others? I know it's 4:09 already. So I guess we can get started. Is that okay with everyone? Yeah. So Jay, I think we can start with your items.
Sure.
Yeah.
Just we'll give some updates from the county. I'll try to be concise. So just with the first thing is our upcoming campaign. So we are still on track right now. For those of you, just to be brief, who haven't heard about it, our county program is looking to launch a suicide prevention program that's aimed at, middle-aged English and Spanish-speaking men. So it's like, ages 35 to 54. And we're going to be hopefully doing some radio ads, some online ads, in the area with some like special zip codes and stuff to try to target people and those kinds of things. And things are looking really good. Still on track for December 21st is our hopeful launch date. And just, as soon as we have more on that, like if we have we're going to have a digital flyer and we're hoping to get this, the word out in the county, can send all that information to Hope Task Force members, and we can, take it out and get the word out and see if we can just have an impact. So it's a suicide prevention campaign. Sorry if that wasn't stated. So that's the first update. Our second one is that we have been, my manager, Mega Lien, and I have been trying to get involved with primary care and increasing suicide prevention among providers. And it's been kind of a tough going, but we think we might have gotten some good luck with, Vic, you mentioned Dr. Chu, Joyce Chu, and Chris Weaver. So we were working on improving suicide prevention as a whole in primary care and what's called primary care behavioral health. It's sort of a hybrid thing that the Valley Medical Center does. So this can be through improved screening, amended protocols, changes to workflows and processes to help ensure that we are actively promoting suicide prevention. So we're taking on like a comprehensive effort with those PAU partners, Dr. Weaver and Dr. Chu. And we were told by the director of ambulatory care and the chief psychologist at primary care behavioral health that Milpitas Clinic would be a great place to start. And their response to the needs assessment that Drs. Chu and Weaver performed was awesome. So they were identified, and then they continued to work with them because of the staff's open, willingness to help and improve. And so this is hopefully going to yield a primary care upgrade and create some opportunities for growth and some more suicide prevention focus. And the Milpitas Clinic is playing a really, really huge starting role in that work for us. So we thought that was something to bring to the attention, that Milpitas is kind of the starting place for this. So we think it could really take off. So kudos to the Milpitas Clinic.
That's great.
Yeah, it's excellent.
Do we have a contact there? We can invite them to this meeting next time.
I mean, I'm sure.
I
Are you
could try
asking
to
me
find
if I
some.
personally have a contact? I'm sure we could find someone there, but off the top of my head, I can't recall the name.
Okay, we can try to find someone.
Yeah.
Yeah.
So that's just sort of just kind of a top level looking down, like what the work is going to be like. And we just wanted to bring it to your attention that Milpitas's willingness to help with us is amazing.
Perfect.
The next item is just youth and school support. So we have the Herd Alliance and the Herd Alliance partners. This is an update from my teammate Jasmine. So she said that the Herd Alliance partners are still continuing their efforts with the school districts, mostly with struggling students and staff. So they've got ongoing trainings, staff meeting presentations, and incognito trainings. So right now, she said they're kind of quiet, but they're still doing the training that Vic mentioned earlier. So the Be Sensitive, Be Brave, and Cognito for trainings. And then the schoolwork is ongoing consultations with districts, just reviewing their crisis intervention protocols, advising them on what to do if they're seeing spikes in student crises and increased staff stress, especially right now with COVID. So that's just where our youth and school support work is. And then the final item is safe messaging training in journalism schools. So this is, with COVID being where it is now, it might be tempered a little bit with our, other kind of commitments, but we just wanted to let you all know that we're always looking to do some safe messaging training to make sure that the media are reporting responsibly on suicide, to make sure we're reducing stigma and, making sure that people aren't kind of inducing contagion. So what we have some safe messaging training, and we're looking to shop it to journalism schools, not literally shop for money, but to give this training to journalism schools. So we just thought it would be a good idea in case anyone with hope has some contacts with, whether it's collegiate level journalism schools or anything. If you're interested, you can send over to me contacts and maybe we can have some talks with them about that. That's just where we are with the county. And one final piece that's pretty new. I was just recently tapped to be a COVID-19 disaster response worker. So I'm going to be splitting my time between handling some COVID-19 response with the public health department, and then also in my role as a suicide prevention program. So I just wanted to bring that to the work group's attention that might be splitting some time here and there, so I might not be able to devote as much to certain causes, but that's it.
Yeah. Hey, Jay.
Mhm.
Yeah, for your first item, the suicide prevention campaign with the target of the English and Spanish speaking, and then also the middle age. Is there the thought to maybe expand to Chinese, Vietnamese speaking, and maybe a little bit older adult too, over 54?
No, so that was our previous campaign. We just completed that campaign that was mostly geared at middle-aged and older adults, and that was English. It was predominantly Vietnamese speaking and English, and then we also had some ads for Chinese and Spanish speaking. So that campaign has it was completed in, I think, stopped airing around mid-October or so. And this campaign is actually sort of from per board request. So the Health and Hospital Committee board was asking kind of how things were going with COVID-19 and elevated stress levels in the communities. And we said we were actually into doing a middle-aged men campaign, and they said, hey, well, why don't we put our foot on the gas a little bit on that? So we have been really, really pushing that pretty hard per the county's request. So that's why it's happening so quickly. And the English, we ran some testing with focus groups with those 35 to 54-year-old demographics, both English and in Spanish. And we're just seeing what they reacted to. And COVID-19 is very, very present, as you know, but I mean, seeing it in those focus groups was very cool, but it was also very alarming just how much it's impacting and how differently it's impacting, Spanish speaking and English speaking. So that's why we're doing kind of the two distinct arms of the campaign.
Yeah, and Jay, the previous one, are there any videos or anything captured that we could create a library or have resources ongoing?
Yeah, so we have some videos up. The video ads are up on the county's YouTube page, which, John, if you kind of remind me, I can send you just a link to the YouTube page.
Great. Thank you.
Yeah, and we also have, so from that campaign, we still have those websites that will remain active in perpetuity. So
great. Thank you.
Maybe I'll add something, Jay, because we've run this campaign before. So for those who don't know, the category of individuals who most take their lives in Santa Clara County and in California and in the US are middle-aged males. Tends to be Caucasian white males. So that's why some of the emphasis in that area. And I hope maybe, Jay, when you send you should send information to people, I hope that people will say something just in their individual circles or beyond about this campaign. When we ran it several years ago, because it's the first real campaign that we ran in the county program, what we saw was with the crisis line, we went from a fraction of the calls being from that category individual to significantly higher. It jumped exponentially. And I think we saw a little bit of a decrease in deaths in that category. And we ran it a couple of times after that because of that. But then in the interlude, we haven't done that with other things coming up. So I'm glad we're doing it again. And we've seen that it's had an impact. And the more people know about it, I think maybe the greater impact it'll have.
Thanks, Vic. I second all of that. Yeah, so it was actually almost a direct request because one of the board members was asking specifically when Mego gave an annual report, give them kind of the rundown of the numbers in the county. And he was asking very straightforward, why is this happening? Why is this demographic still seeing such high rates? And what can we do about it? And what's happening with that, along with what's happening with COVID-19? And they sort of said, hey, well, we support you. So it was kind of strange with all of the budgetary cuts happening around the county that they really gave us kind of a thumbs up and like, hey, if you have the funding, use it. So hopefully this is successful. And as Vic said, yeah, we're going to try to get it out to the community. So whenever we are ready to launch, you'll all know. And if you can kind of, 6 degrees of separation, just get this thing to spiderweb out, it'd be awesome.
Thank you,
Okay.
Jay. Thank you. Anything else, Jay, you wanted to add? That looks like you guys are pretty busy.
We are pretty busy. I'm sorry I was loud talking.
That's okay. So I think before I move on to my items, if anyone else who joined late wants to introduce, Tegan, we missed you. And I see Matthew.
Hi, it's nice to see everybody. For those who are new, I know that we have a couple new folks with us today. I'm the Community Engagement and Inclusion Administrator for the city and oversee the Hope area. It falls in my team. So happy to have you here. Thanks for joining us.
Thanks.
Hi, this is Matt Jacobs from Kaiser Permanente. I got to see on mute because I got little kids around. So thank you for having me.
Welcome, Matthew. So I'll move to my items. We did 2 town halls in city of Milpitas last month. Lisa Miller from Cassie hosted those for us. We had a total of, so one was towards the catered to the teens and the other was for the parents. We kind of opened the parents one to all ages. Total for both the town halls, we had about 21 participants. I would say the teen participants were more, they were more open and engaged. Parents were more of good listeners. So I think, but both the groups got what they wanted, and we will be following up with them. I haven't heard from Lisa, but I know she's been busy, and it's nice to have you, Elena from Cassie. The surveys were shared by with everyone. We do have 2 more town halls coming up. One is tomorrow in Vietnamese language. So if you have anyone who's interested in participating, the other one will be on 16th of December, All Alone for Holidays, and it's going to be hosted by Dawn Brown from NAMI. I don't see her today, but I have a meeting with her after this. So I think she's been busy. But other than that, I think we are getting the message out.
Terry, did you want to mention the future ones that we're planning for the new year?
Yeah, so I am talking with folks from Q Corner and other people as well, some community members on LGBTQ town hall that we are planning to either bring to the community in January or February, depending on when our hosts are available and the panelists. We also have one in Chinese language, Mandarin, Cantonese, again, in planning stages, but it should be offered in January. The other one that we are planning to bring is for the seniors. The topic is same, managing stress and anxiety during COVID-19, but the one on All Alone for Holidays, we are opening to college students who are residents of Milpitas but are away in attending colleges all around the country and cannot come back for holidays. So we are planning to open it. Hopefully we'll get some participants from that group. I think, yeah, and one more. I'm talking to Aki and Behavioral Health about providing one in Spanish as well. So Jay, if you have anyone in mind, please connect me with them. I'll get in touch with Jasmine or Evelyn. I will.
Yeah, if you can just send an email and
yeah, I think they know. Yeah, they know. So we are looking for a Spanish speaking host as well. Yep.
Great. Thanks.
Yeah. That's from me on town halls with City of Milpitas. I did share flyers with everyone, but I see some new faces here, which so I'll go back and share the flyers again with everyone. Yeah. Okay. So I think we can do the work group updates.
Sure. I can do the first one, diversity. We have not met, but I'm happy to see that 2 of our new members sort of help us represent diversity. Sarah, we're happy to have you here as a result of Tom's invitation. And hopefully you can help us reach out to the older adult population. And then Sucleen, we were so happy that you discovered us and joined us and bring a teenage voice to the group. That's really awesome. We are going to continue in the new year working on diversity, and both in terms of the programming and members of the group, and specifically people who can help us reach communities that we feel we're underrepresented in. So please feel free to invite friends whenever we have a meeting. I guess I could do postvention too. We haven't had a meeting on that one either. We do have our new website up. I hope everybody had a chance to look at that after the meeting last week or last month. And the grief resources on there would be the basis for our postvention handout that we're developing for our public safety police officers to carry with them. We also are hoping to work on a letter from the city that could be offered in the case of suicide in Milpitas, and also we could use some safe messaging training for our PIO and communications team at the city. So we'll be coordinating to try to get that to happen in the new year as well. Thanks.
And then Charo, I think for the teens and transitional youth, we didn't meet last month. We put our energy towards the first town hall, the youth town hall, which again we feel was very, very successful. Lisa did a great job. But we do plan on meeting this next Thursday, the 17th, and our plan is to plan and prioritize the work group projects for the upcoming year. So when we meet again in January, we hope to propose and offer quite a few projects for next year.
That's great.
And one last thing, we will be adding, Sandra will be joining our group again on that. So we're looking forward to getting Sandra's input.
That's great.
Great. Did you want me to give a couple of other item updates?
Yes, please, Tegan.
Okay, thank you. So one that I wanted to let everybody know about is the city of Milpitas is starting a new nonprofit, Milpitas Nonprofits group, and we're trying to invite nonprofit organizations that are either based in Milpitas or working with Milpitas clients to join us. And we're trying to facilitate partnerships as well as find out how we can help as a city, help the nonprofit organizations better serve the people in Milpitas. So if you didn't get an invitation from me for that, please let me know. I'll be happy to send you one. If you have any ideas of nonprofit organizations working in Milpitas that you think we ought to invite that maybe we don't know about, please let me know. That's going to be January 7th from 4 to 5, and it's also a Zoom meeting. And we are hoping to do that on a quarterly basis, checking in with our nonprofits that are serving Milpitas. The other thing I wanted to let folks know is that we will be making a report to City Council in probably late January on the activities that we've been doing here in Hope, specifically the town halls and some of the other efforts that we identified in the summertime, kind of where we're going with those and what we hope to do in the next 6 months or so. So, thank you.
Charo,
yes, Ron.
I think we did introductions and welcome, but did we want to do any updates from any of the task force members? I know Vicki, you usually have some great information, or anyone else?
Yeah, we can open, I think all our agenda items are covered, so we can open the floor to anyone who has anything to outreach for.
I was going to ask something of you.
Yeah.
Interesting. John would point to me because I'm going to point back to John. I want to go back to the history of this committee. What's going on, this meeting, what we're doing now. It started because three of us wrote an op-ed piece for the San Jose Mercury News. And then city council member, actually vice mayor, Marcia Grilli, noticed or read that article and called a group of us up, and we all had a meeting. Tom was at that meeting, and a staff member and Vice Mayor Grilli and Council Member Nunez were at that meeting. And then two of us that wrote the op-ed were there, and they talked to us about what we were doing, and that led towards the city doing a policy for those who don't know about that city council meeting or weren't in attendance. Actually, it was, of all the work I've done, I'd say from a community point of view, it was one of the more moving council meetings I've been at, where the council has adopted a city suicide prevention policy. And part of that effort was led by the two council members I named before. Not that some of the other council members, all of them, it passed unanimously, including one of the council members talked about his personal experience on the public record. And the reason why I bring it all up is because now the two council members that are involved, they're no longer on the city council. Though Ms. Grilli's attended these meetings, I know she's not here today. So what's the punchline? Why am I bringing that up? It'd be helpful if you asked a council member if they can attend this meeting. It's you try and keep that tie, that linkage. I might have a bias because some of you know I'm not in Milpitas, but I'm a former city council member and mayor of the city that I live in. And I always think that it's important to have that connection, direct connection between the city council and in a community, city-run entity like this. There's many reasons for doing that without going into it, but one of the key ones is to have support from your local decision makers. And it's interesting what Jay brought up earlier. You can see it wasn't by accident. We've done our groundwork at the county level, and so our supervisors, almost to a person, are involved with the county's, or at least aware of the county's suicide prevention efforts. So when we go into a meeting and we intentionally set up that annual meeting on our county plan so that it never loses visibility with the decision makers in the county. And you can tell from what Jay said, I mean, he mentioned just partially some of the feedback that was given at the annual, but it's done on purpose to keep a tie between the people who are going to help fund the project and should be involved in some of the decisions that go on. So
Yeah, sure.
That was a long-winded way of saying, I hope you invite a council member. There's a couple of them that made strong comments on the night that the city suicide prevention policy passed, and keep that involvement.
I'll
talk to Evelyn.
And Tegan, I think we can work with Renee on in that effort. But I think there's strong support and interest in that.
I think that's part of our meeting plans for the city council meeting, because we do have a new council member. As you said, some of our council members who've previously been more involved with HOPE are not on the council now. And so we do need to make sure that the new folks and the ones who will remain understand the importance of the work that we're doing, and that they stay involved.
That isn't to say, by the way, you should continue to invite the people who initiated this effort. You never know. In the city I live in, we recycle prior council members. Some of them come back. They never go away. They just return. They take a hiatus for a little bit and then come back. In any case, you get the point I'm trying to make.
Yeah. So that's a really good point. And I think we can work with Renee to bring that. Before we announce the meeting date for next month, any more updates? comments? Any
Hey.
events coming up?
Hi, everyone. It's Sandra. So we had our communication specialist in our district, Scott Forster, send out the links to the HOPE website, which is what reinvigorated, like, oh my gosh, I need to be part of these meetings. But I just checked the website, and the ones that for the upcoming webinars that are on there are from November. So I was curious about the one that you referred to that's happening tomorrow, because I want to help advertise. I'll blast it out too. I just want to make sure I have the right links.
We'll get it up and I'll get you the flyers right after this meeting. I'll email them to
Fantastic.
you. Yep.
Thank you.
Yeah.
And Elena and I have worked together for a few years now. And so anything that comes up with like school-aged or parents of our students and you need panel members, if it's not me, I can find you someone. So just feel free to keep us in mind.
That's really good to know. I will be contacting you right after this meeting.
Okay. If it's tomorrow, I don't know about that, but
No, not tomorrow. Tomorrow we have it figured out.
And keep me in mind as well.
Yes,
Thank you,
yes.
Sandra.
yes.
Yeah. I'll send it to both of you. Any more updates?
One thing I would just like to call attention to is that Vic posted in the group chat the link to the training registration for Be Sensitive, Be Brave for mental health. So.
Yeah. Yeah.
Sandra actually posted that. I sent Tegan and imagine she will send it out later because it's a 8-part webinar series. So it's not just the one that's going to happen next Tuesday. The only reason why I talk about more is I help set that webinar up. But in subsequent months, each month there'll be a webinar. It's usually the second or third Tuesday of each month.
Okay. And do you know how long each webinar is for?
Yeah, that go from 10 to 11:30.
Okay.
And for those, since I know a few people on this meeting, for those, maybe the most interesting part is the last 15 minutes is left for questions from the public. So Joyce's talk will be an hour and 15 minutes at the maximum, and there'll be at least 15 minutes, maybe more, for people to ask questions of her. And the next month in January, I think it's actually January 26th, some of you may know our own local, Dr. Shashank Joshi, will be talking about suicide postvention, along with my wife, probably will be involved with that. But anyway, the schedule's out there. People can see and pick and choose what they want. The one other thing I was going to mention is the second Tuesday of each month in the evening from 7 to 8:30, NAMI Santa Clara County holds their general meeting. I'm the co-president of the chapter. I wouldn't necessarily be PRing it, but January 12th, the meeting will have Jay's manager, Mako Lien, will be speaking about the county suicide prevention program. So if people want to, Jay brings up certain things because there's some other work going on in other work groups that we have. But if you want an overview of the county's program, Mago's going to do that on January 12th. If you want to find how to register, just go into NAMI Santa Clara County.
Okay. That's good to know. Anything else? Thank you so much. I think I'm going to register for that webinar. It's going to be helpful.
It might be up to 5,001 people now.
I just put a link in the chat as well to the Project Calwell webinar series, the articulation. So it has the headlines that Vic was just describing. And it's the same registration link as the one above. You just have to make sure you're clicking the right, or scrolling down to the right date.
Oh, okay. Thank you, Sandra. Okay, if we don't have anything else, then our next meeting will be Jan 12th. And we'll send a Zoom link out. And yeah, and I'll remember to email the 2 flyers for tomorrow and 16th again out to everyone. I know Jay has them. I got your response. Yeah.
They look good.
Yeah, thank you. So should we go ahead and close the meeting then, if we don't have any more updates? Yeah.
I guess
Okay.
so.
Well, happy
Take
holidays
care,
to
everybody.
everyone.
Yeah.
Stay safe.
Be safe.
Happy holidays.
We'll meet in
Bye-bye.
2021. Bye.
Sounds
Bye.
good. Thank you.
Bye.
Bye-bye.
Thank you.
Thank you. Bye-bye.